7th, 2021. Right now the time is 20:30. Now I'm just going to be comparing the physician's orders to the MAR. This is for Nursing Jake. Nursing Jake, fitness 312, 312, 654, 654, 987, 987. Date of birth is January 1st, 1960. January 1st, 1960. Dr. Skills Lab, Dr. Skills Lab. And as you can see, patient no known allergies, no known allergies. Okay, the medications we're going to be giving today are metoclopramide. Metoclopramide doses 5 milligrams, 5 milligrams, route by subcutaneous, subcutaneous. Time frequency is once daily at 0800. Right now the time is 20:30. This medication has already been signed off for and given, so therefore we will not be administering metoclopramide. Okay, next medication we're going to be giving is diamond hydrogenate. Diamond hydrogenate, doses 150 milligrams, 150 milligrams, route is intramuscular, intramuscular. Time frequency is once daily at 2100. Right now the time is 20:30. This medication has not been given and signed off for, so that we can go ahead and administer diamond hydrogenate. And as you can see, these are all been signed off by transcriber and reviewer signatures. Okay, and now I can put the physician's orders away and I can do hand hygiene before I start drawing all my medications. Okay, here's our medication, diamond hydrogenate. I need the dose of 150 milligrams. This vial comes in 50 milligrams per ml, so I will be needing 3 mLs from this vial. And the route for this medication is intramuscular. Intramuscular says intramuscular right here, so I can give that via that route. And this medication, I'm just going to be checking for the expiry date. This medication is not expired. This is good to give. And I'm just going to be checking the parenteral drug monograph regarding this medication, get some more information. Okay, this is diamond hydrogenate. Diamond hydrogenate, this is an antiemetic for nausea and vomiting, and it can be administered by a nurse or a student nurse, such as myself. And over here, I do see the maximum single dose is 100 milligrams. And I have been prescribed to give 150 milligrams, which is over the maximum single dose. So in this situation, I'll be contacting the physician and gaining clarification if I can continue with the procedure or not. And I have called the physician. The physician said it is it is appropriate for me to continue with the procedure and give 150 milligrams of this medication, even though the parenteral drug monograph says I can only give 100 milligrams max single dose. And over here, once I've done that, over here it also says I can give this intramuscular undiluted, which is exactly the way I'm giving it. And maximum concentration is 50 milligrams per ml, which is exactly the concentration per ml we're going to be giving this. And some potential hazards regarding this medication are drowsiness, dizziness, and weakness. So I will be taking those into account when I do my patient education and what I monitor for my patient. Okay, I can put that away now. I can do hand hygiene before I start pulling my supplies out. I will be needing a blunt fill. I will be needing a 3 ml syringe. And I will be needing a 23 gauge 1-inch needle, which is the appropriate size for a intramuscular injection. Okay, now I'm just going to be getting my supplies. I'm going to be needing an alcohol swab. I'm going to need an alcohol swab, and I'm just going to be working the top of the vial for 30 seconds. Top of the vial for 30 seconds. In a circular motion. And in a clinical setting, I would go for a full 30 seconds, but let's just say it's been 30 seconds of cleaning. I can discard this. I'm just going to do hand hygiene now. And now I'm just going to get my syringe. I'm going to discard this. I'm going to be getting my blunt fill. And we are locking that onto and I can discard this. I'm going to be pulling the plunger back to about 3 mLs, which is what I'm going to be injecting into my syringe. Okay, and I'm going to uncap this. I'm just going to put that in the garbage. I'm just going to uncap this, and I'm going to be okay. Now I'm just going to be lifting this upside down. I'm just going to be drawing back all the medication that I need. Okay, I do see that I have some excess, which is fine. I can just get rid of that after. And I'm just going to be scooping this. Just going to be capping that. And I'm just going to be pulling this back, getting in my pen, smacking any bubbles that I have. Okay. Okay, now that all my medication is within my barrel, I can transfer this over to my needle, and I can discard this into a sharps container. Okay, and now this can just go into, it's going to lock that onto my needle. onto my syringe, and I can discard that, and I'm just gonna be priming my needle now. Okay, I see a bleb at top. I do have excess, so I will be uncapping this, and I will be going over the med waste container over here, just getting rid of the excess that I do not need. Okay, I have gotten rid of the excess medication I do not need. I'm just gonna be capping this now. And now I'm just gonna be, okay, and this is 3 mLs of the medication that I need. It's primed and there's no bubbles. Okay, and I'm just gonna make my drug cart for this medication. This is for nursing Jake, and the drug name is hydrogenate. Dose is 150 mg. Volume is 3 mLs. Concentration was 50 mg per ml. Date and time is February 7th, 2021. Right now the time is 2030. MKU and SN year 2. Okay, that's my drug label. You can check that out. Okay, now that I'm done that, I can quickly just do my second check. This is for nursing Jake. The medication name is dimenhydrinate, and the dimenhydrinate, and this dimenhydrinate in there. And the dose of the medication is 150 milligrams, and the vial did come in 50 milligrams per ml, which is why I have 3 mLs of medication in my syringe. And the reference medication is intramuscular, and the vial is intramuscular, and this is intramuscular as well, and I do have an intramuscular needle gauge and needle size on there, so that's appropriate for intramuscular route. Okay, and the time frequency medication is once daily at 2100. Right now the time is 2030. This medication has not been administered, so therefore, and signed off for, so therefore I can go ahead and give that, and I can just discard this now. This was a one-time vial use only. I can put that to the side, discard that, and I'm going to be getting supplies from our patient's room. I'm needing my clean gloves, my pen and pencil. I'm going to be needing alcohol swab and a cotton ball, and I'm going to need my MAR. Okay, so now we can head over to the patient's room. Okay, upon entering the patient's room, I'm just going to be doing my entry safety check. I'm going to be making sure the bed is in the most efficient possible, call bells in reach, patients are in distress, and there's no tripping hazards. Once I've done that, I can put my supplies down, do hand hygiene, and then I can go introduce myself to the patient. Hi, my name is Mohit Kaushal. I'm a student nurse from the University of Manitoba, and I'm going to be taking care of you today. Do you mind if I just verify your ID with your armband? Okay, perfect. Nursing Jake, fitness 312-654-987-987, date of birth January 1st, 1960, Dr. Skills Lab, and no known allergies. Could you please tell me your full name and date of birth, please? Okay, Nursing Jake, date of birth January 1st, 1960, and do you have any allergies? No allergies? Okay, perfect, that's exactly what we have over here. Okay, Mr. Jake, I'll be right back. I'm just going to be doing my third check by the bedside. Now I can do my third check. This is for nursing Jake. The medication name is dimenhydrinate. This is dimenhydrinate in there. The dose is 150 milligrams, and the vial they come in 50 milligrams per ml. That's why I have 3 mLs of medication in my syringe, which is 150 milligrams. And then the route for medication is intramuscular. This is intramuscular, and this is intramuscular needle gauge and needle under. And the time frequency of medication is once daily at 2100. Right now the time is 2030, and this medication has not been given and signed off for, so therefore I can go ahead and give that. Okay, once I've done that, I can just put these back, and I can go ahead and do some patient education with my patient. I'm going to do hand hygiene first. Okay, Mr. Jake, I'm going to be giving you your dimenhydrinate today. Your dimenhydrinate is just an antiemetic for the nausea and vomiting you've been experiencing. And something I'm going to be assessing for before I give this medication is your current level of nausea. I'm going to be taking a full set of vital signs just to make sure they're all stable and within the range for me to give this medication, and I have done that. and you do have nausea right now, and your vital signs are stable as well, so that indicates that you should be giving this medication. And something we're monitoring for after I give this medication is the therapeuticness of prevention of nausea and vomiting, which is the desired dose for this medication. And I will be monitoring your vitals and your level of nausea every hour. And some side effects you might experience regarding this medication is dizziness, drowsiness, and weakness. So if you do experience any of those, please use the call bell and call me. And once I've done patient education, I can quickly do hand hygiene. And now I'm just gonna landmark where I'm giving this medication. I'm giving this medication in the vastus lateralis muscle. Your vastus lateralis muscle, I'm just gonna be landmarking it on myself first, and then I'll be injecting on the abdominal pad. Okay, for your vastus lateralis, first thing I'm gonna do is put my hand on the bony prominence, which is the greater trochanter, on my near my hip, and then I'm gonna be putting my hand on the superior aspect of the knee, and then I'm just gonna close in a bit, and then the vastus lateralis is gonna be the muscle that's gonna be on the anterior lateral side of this muscle right here, and that's exactly where I'm gonna be injecting. Okay, now I have landmark where I'm gonna be giving this medication. I'm gonna be giving them the vastus lateralis because it can handle 3 milliliters of fluid, and now I've done that, I'm gonna do hand hygiene, and now I'm just gonna be taking my supplies where I'm gonna be injecting. And I just want to mention, I'm going to do hand hygiene now, putting on my clean gloves. And I just want to mention that some facilities require you to aspirate before you give an intramuscular injection. But the facility I'm currently at right now does not require me to aspirate, so therefore I will not be aspirating in this demonstration. Okay, first thing I'm doing is just taking an antiseptic swab, wiping over the spot where I'm going to be injecting for 30 seconds in a circular motion. Okay, we can just see that it's been 30 seconds of cleaning, and I would let the alcohol air dry. And I'm just going to be uncapping my needle for intramuscular injections. I'm going to be doing this Z tracking method, and I'm going to be going on a 90-degree angle. Z tracking method, I'm just going to be sliding the skin to the side, and then I'm going on a 90-degree angle. Then I'm going to be stabilizing, and then I'm going to be injecting slowly. And then once I've done that, I'm stabilizing and then taking the needle out. And then I would be letting go of the skin just so the medication stays sealed in within the muscle. Then I would be activating the safety mechanism on my needle. But for this demo purpose, I will not be doing that right now. And I could just be capping this, and I would activate the safety mechanism, throw it in the sharps container where it belongs. And right now I can just put that back right there. And I will be putting the cotton ball over the place where I injected. Where I injected for 30 seconds just to make sure it doesn't bleed. And once I'm done that, I can, it's been 30 seconds now, I can just take the garbage, and I can just put it over here, and now I can just take off my clean gloves. I can toss everything that I don't need in the garbage, and then I'm just doing hand hygiene, and then now I'm gonna be signing the MAR. In the clinical setting, I would sign the MAR with a black pen, but for demo purposes, I'm gonna be signing with a pencil. Okay, I signed the MAR. Okay, and once I've done that, I'm just going to quickly talk to my patient. Okay, Mr. Jake, I've given you your diamond hydrogenate. I will be back in about an hour to assess, take a full set of your vitals and assess the prevention of this medication, therapeuticness of this medication, which is to prevent your nausea and vomiting. And before I go, do you need anything? And if you do experience any of those side effects that we talked about, please use your call bell and call me. And yeah, before I go, I'm just gonna do my exit safety check, making sure bed is in the lowest position possible, patient's not in distress, call bell's in reach, and there's no tripping hazards. And once I've done that, I'm okay to leave the room with my tray.